Okay, so as we study the cardiovascular system, one of the things that I hope you understood is there are a couple of major things that can happen. If the heart's not pumping, if blood's not moving forward effectively, the heart's a pump. If it's not pumping effectively, or it can't pump blood where it needs to, what happens? So if it can't, the tissue that the heart can't get to doesn't get enough oxygen, or if it's the lungs, it can't put oxygen into the blood, right? The tissue that is behind that is going to get flooded because there's too much fluid they can't get rid of. So the two major manifestations I want you to look at are hypoxemia and CHF. And we're going to talk about hypoxemia in this section. We've also talked about more chronic complications of either too much pressure or cholesterol buildup, things like that. And those chronic complications, we've already discussed a little bit. So I want to talk about the major manifestations right now. So hypoxemia is a PaO2, partial pressure of oxygen in the arteries, that is lower than normal. And there are two ways to measure it. It can be measured by O2 sat, that is the saturation of hemoglobin with oxygen, or by ABGs, they draw arterial blood and look at the actual partial pressure of oxygen in the blood. Now, O2 sat is not a one-to-one correlation with arterial oxygen levels, okay? You're used to using O2 sat for monitoring oxygenation because it's not invasive. It's easier, but there are times that it's not the most effective. Hypoxia is a reduction in tissue oxygenation. Hypoxemia is a reduction in the oxygen of blood, okay? And they tend to go together. If we don't have enough oxygen in the blood, we're not going to have enough oxygen in the tissues. Cyanosis is blue discoloration related to hypoxemia. It's an assessment finding, and it's not a measure of how hypoxemic that patient is. It's just an assessment finding. This patient is cyanotic. Let me find out their oxygen. Okay. What does this look like? Okay. In acute hypoxemia, we're going to see cyanosis, shortness of breath, poor feeding, tachypnea, right? Because they're trying to get more oxygen in. Chronic hypoxemia leads to failure to thrive. Polycythemia or anemia. Either they make more red blood cells to compensate, or they're not able to make enough red blood cells. Clubbing of the fingers, remember finger clubbing or nail clubbing. Developmental delays because of chronic hypoxic damage, and they're at risk for other complications because your tissues don't do well if they chronically don't get enough oxygen. Diagnostic testing is used to determine the cause. There is a test called the Hyperoxia Test. An infant is placed in a 100% oxygen environment for a short time because remember, excessive oxygen actually causes some tissue damage, but for a short time in a 100% oxygen environment, if the PaO2 is 100 millimeters of mercury or higher, it's probably a respiratory cause. If it's 100, if it's less than 100, it's probably cardiac. Now, this is assuming that the child is able to breathe and exchange gases in order to get that oxygen in. But if you give them 100% oxygen and their oxygen level goes up, it's over 100, they probably have a respiratory cause for that hypoxia. We also want to use history. What in the history can give us some hints about why this patient is hypoxic? A chest x-ray can show both heart and lung structural issues, and EKGs can show cardiac issues. Medical treatment for kids who are hypoxemic. If they have a defect that requires the ductus arteriosus to stay open to allow some mixed blood to circulate, then prostaglandin E helps to keep the ductus open longer and enable them to oxygenate somewhat. Remember, they're not going to be getting purely oxygenated blood circulating because that's mixing, but it does allow them to get some oxygen to their tissues. They need to be kept hydrated. maintain adequate blood pressure, monitor for anemia, and prevent respiratory infection. Okay. And then medically, they're trying to find the cause and fix it. Nursing management, we need to keep that child hydrated. We need to prevent and manage respiratory infection, manage respiratory distress, and teach and reassure that patient how to cope with the anxiety, how to deal with questions from others. Kids who have heart defects may be slightly cyanotic all the time, and people notice that. And so they may ask questions and make comments. So that's how to deal just with the hypoxemia of these defects or these diseases until they're able to make some surgical corrections. Okay, next section is going to be longer. It's about heart failure.